Good day, ladies and gentlemen, and welcome to the Quality Measures MACPro CMS Review Demonstration Conference Call. My name is Tony, and I will be your operator for today. At this time, all participants are in listen-only mode. Later, we will conduct a question-and-answer session. If at any time you require operator assistance, please press star followed by 0, and we will be happy to assist you. I would now like to turn the conference over to your host for today, Ms. Jeanette James. Please proceed.
Thank you, Tony. Greetings, everyone, and welcome to the Medicaid and CHIP program, MACPro, Quality Measures MACPro CMS Review Demonstration. My name is Jeanette James, and I am part of the Center for Medicaid and CHIP Services in the Data and Systems Group under the leadership of Jessica Kahn and Deborah Stewart. I work in the Division of Operations and Technical Services under the leadership of Donna Kaufman. Our division assists the business component in helping and developing training and assistance to the MACPro user community. Today, we will provide an in-system demonstration on the quality measures reporting. I will now turn it over to Megan Thomas to provide an overview of today's training. Megan?
Great. Thank you so much, Jeanette, and hello to all of our colleagues on today's call. As Jeanette said, my name is Megan Thomas. I'm a Technical Director in the Division of Quality and Health Outcomes here in CMCS. I want to welcome you to the MACPro in-system demonstration for the CMCS quality measures, and thank you for joining us today. So over the past few months, we've introduced MACPro as a new system that will allow states, territories, and CMS to process Medicaid and CHIP initiatives, including reporting on the CMCS quality measure steps, for which MACPro will be initially released later this month. And this includes the child, adult, and health homes core set of measures, as well as reporting under the Maternal and Infant Health Initiative measures as well. So today's in-system demonstration will provide an overview of the CMS Quality Measure Report review process in MACPro, and it's our aim that through this training, attendees will learn the process for reviewing quality measures reports submitted by state. So on behalf of the business owner team, including Kimberly Peralt, Krista Spiker, Lakeisha Daniel Robinson, and Josh Hardy, and with the help of a plethora of folks from across the center as well as contracting staff, we look forward to introducing MACPro to you more in depth over the next few hours. I'm now going to turn things over to the presenter for today's CMS Quality Measures Report Review and System Demonstration, Katie Lane. Katie?
Thank you, Megan. Good afternoon, everyone. My name is Katie Lane, and I am with Truven Health Analytics. Truven Health is the education, training, and assistance contractor for the MACPro system. I'll be walking through this demonstration with you today, and the purpose of this session, as Megan mentioned, is to help you understand how to review a quality measure report. This call is on presentation mode now to prevent background noises, and there will be opportunities to ask questions throughout the presentation. CMS and training personnel are here to assist with any questions that you may have. Our agenda for today includes an overview of MACPro, the 5 user roles available to CMS and their responsibilities, as well as a high-level synopsis of how to review a quality measure report. If you attended last month's MACPro roles training, the information presented in these slides will be a refresher for you. After that, we'll move on to a step-by-step in the system demonstration on how to review quality measure reports and some additional functionality in the MACPro system. We'll end the presentation with information on how to contact the MACPro help desk to obtain technical assistance, next steps on getting started in MACPro, and an opportunity to ask questions. So let's begin by discussing what MACPro is and the roles available to CMS users. Again, parts of this will be familiar if you have attended previous MACPro trainings. MACPro is a web-based system for the submission, review, and management of Medicaid and CHIP initiatives such as quality measurement, reporting, and state plan amendments. For some applications, MACPro will be a new online submission tool. For others, it will be a change from what was a manual workflow to an electronic workflow. And for some, it will be the first time information is collected. In terms of quality measurement reporting, MACPro replaces the CARTS reporting for adult core set reporting in Section 2A of Child CARTS report. Additionally, health homes core set reporting will be reported for the first time using MACPro, and MACPro is also the system for reporting under maternal and infant health developmental measures. MACPro is being implemented to improve the state reporting and federal review processes, program management, and transparency. Both CMS and states will know where a submission resides, when the CMS response is due, and the status of the review. Additionally, MACPro supports data-driven decision-making for Medicaid and CHIP programs. A number of distinct roles have been established for CMS users. These roles determine in what capacity a user will employ the system. It's important to note that the user roles in MACPro differ from those that are used in CMS's other web-based systems, and in some applications, this is the first time that there are roles. We will be using the CMS Central Office Administrator or CMS CEO Admin role for our in-system demonstration today. This role has the ability to perform a majority of the functions within MACPro, including completing reviews, creating and completing Seek More Information requests, browsing and viewing quality measure submission reports, viewing and modifying CMS user profiles, approving CMS user roles, adding and updating extension dates, reassigning quality measured user tasks, disassociating quality measure users, and generating data reports. We will not be using the CMS Contractor Central Office Administrator, also known as the CMS Contractor CEO Admin role, for today's training demonstration. However, the role may perform many of the same actions as the CMS CEO Admin, which we reviewed on the previous slide. Individuals with this role can complete reviews, create and complete Seek More Information requests, browse and view quality measure submission reports, add and update extension dates, reassign quality measure user tasks, and generate data reports. The next three roles we'll discuss are for individuals who do not have an active part in reviewing state reporting, but have a professional need or interest in having access to the reports. We will not be utilizing these roles in today's training demonstration, but you will understand how to move around MACPro based on what we go through today. The CMS Central Office or Regional Office, CMS CO and RO role is for the CMS staff with no direct responsibility for implementing or administering the Medicaid quality measurement programs, but who may be interested in states' reporting of measures. Individuals with this role can browse and view quality measure submission reports and generate MACPro data reports. The CMS Contractor role is for CMS contractors or researchers with no direct responsibility for implementing or administering the Medicaid quality measurement programs, but have CMS-related or approved business needs to access states' measurement reporting. Individuals with this role can browse and view submitted reports and generate data reports. And finally, the CMS System Administrator, also known as the CMS Admin role, is for CMS personnel that have no direct responsibility for implementing or administering the Medicaid quality measurement programs, but are involved with assigning and approving MACPro staff. Individuals with this role can approve or disapprove the state administrator role, approve or disapprove the CMS Central Office Administrator role, reassign state admin tasks, reassign tasks for the CMS CO Admin, and disassociate the CMS CO Admin. Please note that our process to obtain IDs will change over time. There may be activities on the list that the CMS System Administrator may not be able to do initially, but will further down the road. Now let's review the CMS workflow for reviewing a state's quality measure report. Here is a brief overview of the CMS Quality Measures Review Workflow. First, the CMS Central Office Administrator, as I mentioned before, this is also called the CMS CO Admin, receives an email notice that a quality measures report has been submitted by a state. The CMS CO Admin logs into MACPro and reviews the report. If they do not have any questions about the report, the CMS CO Admin accepts the report, which sends an acknowledgement receipt to the state. If they do have questions, the CMS CO Admin sends a Seek More Information request to the state, and once a response is received from the state, the CMS CO Admin reviews the report again, and if all the questions are answered, accepts the quality measures report. So here's a more detailed workflow showing the steps to review a quality measures report. We will walk through this process in the MACPro system, so don't be overwhelmed by the amount of information and arrows here. So now let's move into the MACPro training environment to begin. Please note that because this is a training environment, you may notice slight cosmetic differences between this demonstration and what you see when you go into MACPro to review quality measure information. State quality measures reports are created by the state editor, reviewed by the state point of contact, also known as the SPOC, and certified by the state director. For this demonstration, we will assume that the CMS Central Office Administrator has received an email saying that a state quality measure report has been submitted and needs review. We will get started by logging into MACPro as the CMS CEO Admin, which we've already done. Please note that the CMS Central Office Contractor Administrator, also known as the CMS CEO Contractor Admin, can also perform many of these duties. So if you have a contractor that you'd like to review the reports, they will be able to do so as well. We are working in the training environment today, and therefore the information that you see during this training is arbitrary information, only being used for training purposes. We're going to be using the Commonwealth of Virginia, but this is not a reflection of Virginia or their quality measure information in any way. Additionally, the actions taken during this demo are not a direct reflection of CMS. When we first log into MACPro, we are taken to our news page. This page operates similarly to a social media platform. You can write a post for your team, send a message to a team member, send a task to an individual, or recognize someone by giving them kudos from the text box located at the top of the page, which we're clicking through right now so you can see what that looks like. To begin our review, first go to the Tasks tab, and this is located on the toolbar at the top of the page. As you can see, reports needing CMS review are listed on this page. There may be more than one report in your queue, so you'll want to make sure that you pick the correct one. And there are a few things you'll notice about the name. The name describes the type of report, and just to clarify, we're focusing on the report ID, and this is what's in parentheses at the end of the task. The name describes the type of report, and there's also a little code at the end. The first two letters of the code are the state or territory abbreviation, so if you want to review a report from Virginia, you'll look for the reports starting with VA. The next four numbers are the year of the data, so in this report, it's from 2015 for the federal fiscal year they're reporting on. For health homes right now, they're only reporting on federal fiscal year 2013, so this report ID in the parentheses would have 2013 listed. The next letters represent the type of data, adult, child, health homes, or maternal and infant health, and the type of report, so quality measures, and in the future it might say SPA. Each report also has a MACPro generated record number following it. So in this example we're pointing at right now, the last numbers are 1038. So before we select a report to review, we're also going to take a look at the green arrow above the task link. Notice that the green arrow is pointing toward MACCMS CEO Admins and MACCMS Contractor Admins. This is because the task has not yet been claimed for review, and it currently appears in the list of all users with the correct authorization to receive this task. So this includes the CMS CEO Admins and CMS Contractor Admins. Once you claim a task, the arrow will point towards me rather than the roles that accepted the task, and the task will be removed from all other users' task lists. And I want to point out that the steps we will go through generally apply to all types of quality measure reports, but for the purpose of this demonstration, we will review an adult core set quality measure report. So let's get started by selecting the link to review the report for adult quality measures, but we're going to look for the package ID, which is Virginia 2015 AQM_1022. This takes us to a report from Virginia for adult quality measures. I want to reiterate that this report was created with arbitrary information for training purposes only and does not reflect Virginia's reporting. Before you can review a report, you need to accept the task. As I briefly described a little bit earlier, there may be multiple reviewers for a state, and accepting the task to review the report says that you are taking ownership of reviewing the report content. It will remove the task from other reviewers' queues. So click on the green Accept button at the top of the screen to accept this task. After you select Accept, there's a link entitled Return Task to All Assignees at the top of the page. By selecting this, you can return the task to all assignees. This will give back your acceptance of the task. If you click on the link, you'll be taken back to the task screen and the report will be marked as unassigned in your queue. The report will also appear in all CMS CEO Admin queues again. On the left side of the page, there is also the option to reject the task. This indicates that you want to be removed from the list of potential reviewers for this report. You may also reassign the task to another individual by selecting Reassign on the left side of the page. You then have the option to choose an individual from all assignees or to choose from all users and groups. As a note, if you begin working on a task but then decide to reassign the task to another teammate, MACPro will not save your work. Additionally, the CMS System Administrator can reassign tasks if, for example, someone is on vacation and their task needs to be worked on but it's stuck in their queue. So now let's focus our attention on the report. You'll see on this page that there are a few sections. First is the core measures listed as links, and if you clicked on one of the links, you'd be able to go into the detailed information. Then below here, there's any delivery system information, external contractor information, and report documents if they were included. All quality measure reports, adult, child, MIH, and health homes, will have measures and report documents, but you may see some variations in the sections, such as state-specific measures, and not all of the quality measures report on external contractor and delivery service information. So now let's begin by selecting core measures to review, and we're going to start with the Adult Body Mass Index Assessment, or ABA measure. This ABA core measure page shows the information that's been submitted by the state. In this example, the report says that this measure is not submitted by the state and gives the reason as the service is not covered. Again, this is not a real report, but rather an example for training purposes and is not representative of Virginia's actual reporting. We have a few options at this point. If you don't have any questions on what the state reported, click on the link entitled Back to Admin Screen. If you do have questions, however, you could submit a Seek More Information report to the state. We'll take a look at that process a bit later in this demonstration. For this example, let's assume that we don't have any questions on the measure reporting, and we'll select Back to Admin Screen to review another measure. Make sure that you select the link rather than using your browser's back arrow. Clicking the back button will take you out of the report, and we generally encourage you to steer clear of your browser's back and forth arrows, as it's better to use the internal navigation buttons. Now we are back on the admin screen, and we can select another measure to review. So let's select the Antidepressant Medication Management, or AMM measure. As you see, the state is reporting this core measure, and the page lists its data. You can expand each section and read what the state submitted by selecting the plus or minus button. As a reminder, the data shown here is for training purposes only. We will assume for this example that we do not have any other questions. So like we did for the ABA measure, we'll select Back to Admin Screen. We will now expedite the review process to stay efficient with our time. So let's assume that we've reviewed each of the measures, looked at the delivery system and external contractor information. We don't have any questions for the state on their report. We're ready to accept the report and send an acknowledgement to the state that it's been reviewed and there are no issues. So we're going to go to the bottom of the page and we're going to select the Accept button. Now we're taken back to the tasks page. You'll see that the report is no longer in your task list and the state received an email that the report has been reviewed and accepted. The review process is now complete for this report. So we did just go through that pretty quickly. Before we move on, I'm going to pause to see if there's any questions. Tony, can you please open up the line for Q&A?